This is Martin Shkreli. You might know him from his recent stint in federal prison with charges of securities fraud. This was for taking stock from a biotech company he founded in order to pay off $7 million of debt he accumulated from a hedge fund back in 2011. Or maybe you've been made aware of his very public online beef with Wu-Tang Clan after purchasing their One of One studio album for $2 million.
Old man that's lost his relevance, and you're trying to reclaim the spotlight from my spotlight.
But you've probably heard of him back in 2015 from his most notorious venture of increasing the price of an important drug by over 5,000%, which not only caused massive public outrage, but led to many people assigning him as the most hated man in America due to his lack of empathy for the affected patients and taking such egregious advantage of the American drug pricing policy. But that's actually just the tip of the iceberg. Shkreli's actions to pump up a drug's price by such an insane amount was, yes, a questionable move, but it also raises a lot of concern on the system that allowed him to do this in the first place. How was he even able to freely dictate the price on his own, and why wasn't there a system in place to stop him?
Would you have bought, when you bought this company, did you buy it because you knew that you could raise the price?
We definitely planned on raising the price, that's for sure. We paid a very, very large amount to buy an unprofitable medicine.
Before we dive into that, let's go back for a second and look at what he actually did. Daraprim is the brand name for a compound known as pyrimethamine, which is used to treat the side effects of things like actinomycosis and isosporiasis, but most famously known to be a treatment for a parasitic disease known as toxoplasmosis for people living with HIV and organ transplant patients. It was developed by a Nobel Prize-winning scientist named Gertrude Elion all the way back in 1953, and after a journey through various pharmaceutical companies over the next few decades, landed at Turing Pharmaceuticals, owned by Mr. Martin Shkreli. Originally, Daraprim was sitting at $13.50, but after its involvement with Turing, basically shot through the roof to $750, making a 5,500% increase in the drug's price per pill, much to the outrage of the public. In an interview with Bloomberg, when asked about the motivations behind the drastic change, Shkreli not only stated that his company needed to turn a profit on the drug in question, but also stated that this is common practice in the industry, and Daraprim is still underpriced compared to its peers. And that's just one example of why the American healthcare system needs so much improvement. The United States stands alone among developed nations in permitting pharmaceutical companies to dictate their own prices. When establishing prices for the American market, drug manufacturers do not base their decisions on production costs, but instead they assess the prices set by competitors for analogous products, and aim to position their own prices within that range, regardless of manufacturing expenses or the efficacy of the drug. But wait, if the price increase was so egregious, why not just choose an alternative? Unfortunately for the people suffering from this parasitic infection, Daraprim is the most effective and only option given to patients who rely on the pyrimethamine medication. They don't really have anywhere else to turn to since other options don't really exist. And Shkreli was aware of this. For a pharmaceutical company that offers the best option for a certain disease, as Turing Pharmaceuticals does for toxoplasmosis, the actions of Martin Shkreli begin to seem really greedy, as they possess a product that's indispensable for consumers whose lives literally depend on using it. Moreover, Shkreli didn't conceive of this idea on his own. The decision to inflate Daraprim's price was influenced by the prevailing practice among pharmaceutical companies to endure brief periods of negative PR in exchange for substantial financial gains for their products. But if everyone knows about the horrible corporate practices that happen in the pharmaceutical industry, why doesn't a company just make a generic pyrimethamine variation to compete with Daraprim? The patents are long expired and the drug is more than 70 years old, so it seems long overdue for an update. The answer is actually quite simple, and it's because Daraprim isn't a frequently used drug. According to the New York Times, only about 12,000 prescriptions are filled annually, which is insufficient volume to attract the attention of most companies. From the perspective of a generic drug manufacturer, the Daraprim scenario involves significant fixed costs associated with a variety of factors like constructing a new facility, potential lost revenue from other drugs if they repurpose an existing plant, and the expenses related to research and development necessary to produce the new product. And that's just sort of the way the system is set up in America. There have been Martin Shkreli type individuals who've done the same thing with other pharmaceutical drugs in the past, and there will be more Martin Shkrelis in the future who will do the exact same thing as long as this system stays intact. Sounds a little bit disheartening, yes?